Chapter 2, Health and Medical Care, an Economic Perspective. This is Lecture 1, What is Health Economics? In previous chapter, we said that health economics is the study of allocation of resources to make choices and why we have to make choices because of limited resources we have in medical care. And we explained that we usually try to answer for specific questions in health economics. In this chapter, we start with defining um, health. If we look at the dictionary, we see that health is defined as a state of physical, mental, and social well-being and the absence of disease or other abnormal conditions. From economist perspective, health is a durable good or type of capital that provides services. So in economics, we divide goods and services in two big categories. Consumptions, uh, goods and services for consumption, for current, present consumption, for just present enjoyment and happiness, and goods and services that we invest for future, and we call that durable goods and capital. So when we have a healthy health status, then we enjoy our time. Basically, at the present, we are happy, we don't have any pain. So this is just consumption of health status at the present time. But when we invest in our health, such as following a healthier lifestyle by exercise and a good diet, we are actually investing for the future. And so this is called a durable good or type of capital that we are actually investing in because we wanted to get the flow of services produced from the stock of health that we are investing right now, so that are consumed continuously over an individual lifetime. So this is the stock of capital we are investing for better future, basically healthier health status. So let's see what is health economics again. The best article you can actually learn about the health economics and investment in health is listed in your reading list, is an article by Grossman. Grossman, actually, in Grossman model, we have a initial stock of health. So based on Grossman model, we have an initial stock of health. So this initial stock of health it can be your initial stock of health at birth. Depends on your research, basically question. If you are setting up a randomized clinical trial, a study, then initial stock of health of your patient population, that's at the baseline before interaction with the intervention you're trying to assess. So this initial stock of health could be your stock of health at birth, or could be initial stock of health at the beginning of the year or beginning of a specific period of time. You want to just measure that, right? So this initial stock of health depreciates with age, if not with any other factor. So besides age, there are so many other factors that, like sociodemographic factors and then environmental factors and basically region of residence and type of insurance you have, level of education and income, and so many other factors. Some of them you have control, and for some of them you don't have the control over them. Now, uh, basically, this initial stock of health depreciates with age and so many other factors, but this initial stock of health may be augmented by investment in medical services, so it can be improved. Now, you have to pay attention. Both variables, the initial stock of health and the rate of depreciation in health, are varied from individual to individual, and they are, the initial stock is different by individual to individual and from individual to individual, and the depreciation rates also are varied based on so many other factors. Some of them, we have control over, and some of them we don't have control, such as basically say that, the region of residence you live with the air pollution, or say that a level of the income and type of insurance you have. So what we wanted to do here is basically economists, they try to measure everything, right? They wanted to compare everything. So we wanted to see, you have the initial stock of health, and then also you wanted to compare, see, what is the definition of health. Now, if you wanted to put a numerical value between debt and perfect health, usually we put 0 for debt and 10 for perfect health. And then anything between that, so most of the people are something basically between 0 and 10. Now, if an individual stock of health falls below a critical minimum level, say that 0.1, for example, 0.001, then basically reaches to 0, it's dead. You can actually keep some people for years under life support, ventilator, or all the technical health in a persistent vegetative state, but who wants that kind of life? So the point here is that these medical services, sometimes they may compensate for many of these deficiency or depreciation, health depreciations. Now, so how much depends on the initial stock of health, and depends on so many factors, and depends on rate of investment basically in medical health. Now, so we said that the rate of depreciation could be the rate of depreciation depends on age, physical activity, and the type of lifestyle you have, and environmental factors, and again amount of medical care consumed, and also some of the factors like for example region of residence and education and income level. Now, so if we wanted to measure the health status, we can look at the quantity of life, which is, relatively more straightforward than looking at the quality of life. In quantity of life, you basically wanted to know the number of the life years remaining. But in quality of life, it's a relatively subjective concept, and it's difficult. There's so many actual ways to measure this quality of life, and it's difficult to compare different studies with different quality of life, basically a model and make a decision. Even there are so many cross-country comparison of quality of life and quality of care even in different countries, and they say that United States has a lower quality of life and but a higher cost, but it's seriously it's very difficult to compare and make a decision. Um, so now, uh, how do we want it to measure then? It's basically how do we measure in economics? So we have for from an economist perspective, we always use the utility utility analysis. Utility um, is a measure of happiness in economics, which is a numerical value, such as a value from 0 to 1. So 0 to 1, or say that 0 to 10, depends on. What is important is the ordinal level, not just the numerical value. Um, and it is different for different people. Um, so you can actually value order your utility yourself. You can't compare your utility with someone else because people, they have different tastes and preferences, and they value the utility differently. So now, why good health is important? Because good health generates a flow of services that yields utility, um, or happiness. So remember, utility is a measure of happiness. Now, this flow of services actually generates happiness um, at the present and in the future. How it works. At the present, we look at it as a consumption goods and services. Um, so utility from an overall improvement in quality of life. Basically, you feel good, you don't have any pain, you feel great, and this is actually the current, the present value, present utility, happiness you get from the current um, uh, health status for consumption. You're consuming health because by consuming good health here, your level of happiness actually this present your level of utility and your level of happiness. Now, in with respect to capital good or durable good, then um, so positive state of health um, when you're uh, following a healthy lifestyle, you're thinking about the future health, um, that you wanted to allocate less time to sickness and you wanted to have more healthier many more healthier days available to work or even enjoy life in the future and increase your income or even other uh, activities that they are non basically um, they're not basically um, financial in financial basically measurements. So they are non-financial value. They have non-financial value. Sorry about that. Now, so why good health matter? Why is important? Again, from economist perspective, you're looking at the utility analysis. Um, so when we are comparing two different lifestyles, choices people make, um, one type of people, a person who puts a high value on the future events, is more inclined to pursue a healthy lifestyle. So this person is investing health um, basically in human capital and in durable good, basically in health, um, because this person value more future than present happiness. And there is a second person, a person who puts a much lower value on future events and prefers immediate gratification to basically, now I'm healthy. I can eat pizza and enjoy a good movie in the TV. So let's do that. So the current, basically, based on the current health status, this person is consuming the health. So this person um, don't care so much about the future, or we can say that cares more about the present value than the future. So, um, so generally, again, remember that in economics we categorize um, goods and services in two categories: consumption goods and services, and um, capital goods and services, or durable goods and services. When we have a budget, annually we wanted to allocate our budget, our income, in buying a consumption goods and services uh, and capital goods and services. Usually, generally, people choose to consume a combination of goods and services that provide them maximum utility. Means that when I allocate my annual budget, I um, actually spent uh, most of my money almost to in consumption goods and services, on basically eating in restaurants and watching movies and things like that, and say that 10% or 20% of my money I invest in capital goods, such as buying, say that, a new car, um, or like a TV or something that gives me basically longer happiness in the future than just one-time happiness. Um, so economists, they love graphs and formulas, and here is your first graph. Uh, in this graph, this is the total utility care for health. So the quantity of health is in horizontal axis, is measured in horizontal axis, and the level of utility or happiness is measured on the vertical axis. Now, in horizontal axis, the bigger the number in the right hand side means better health. So it means that H3, people with H3, they have better health than when they are in H2, and their H2, they have better health than H1, and H1 have better health than H0. Similarly, in the vertical axis, we have basically the utility corresponding to each of these health status. So, for example, people with health states at H3, and they enjoy of utility of happiness of U3, which is they are happier than people they have health status of at H2, um, and also these people they're happier in the U2 corresponding to health status with the health status of H2, happier than people um, with health status of H1, and also um, people with health status of H1 with they have happiness of U1, which is bigger than they are happier than people with health status of H0. Now, you notice that this slope, which is showing the upward sloping positive relationship between health and utility, or health and happiness, means that higher health, better health, with better health are happier than people when you are less healthy. So it's upward sloping, but you notice that this is not a straightforward line, and it is actually bowed. And this shows that although this happiness is increasing with increasing in investment in health, this is increasing in diminishing rate, and we call that diminishing marginal utility of health. So, what does it mean? Means that when I am sick in the bed, um, so I'm in H0, and investment in medical care can actually help me to reach to the point of H1, my happiness increase from U0 to U1. Um, then this is much, my happiness is much, the amount of happiness is much higher than when I am in health status of 2, and by investment with the same amount of basically H2 to H3 is equal to H0 to H1, but the amount of happiness is much lower. So this is the diminishing marginal utility or marginal happiness here, um, because I'm already up, and this amount of investment helps my say that health status to improve from say that 7 to 8, for example, out of 10. So this is very basically important concept in economics that we can apply in any discipline. For example, this can be even applied in the daily life, consumption. When you're very hungry, the first piece of pizza gives you a lot, very, very big, basically share of happiness compared to when from H0 to H1, your happiness is U0 to U1 compared to when, you basically are bored and you take the 10 piece of the last piece of pizza, say that 10, and your happiness increased from U2 to U3. And some point, if we continue that, this is going to decrease. So basically, by continuing eating pizza, so your marginal utility is going to increase. Although, so basically, this we say that the total utility always increasing. It depends on, again. Okay, so I told you that we are interested in formula. Here, using formula is another way to illustrate the law of diminishing marginal utility, is to focus on the marginal utility associated with each unit of health. So marginal utility equals the addition, marginal utility of health is equal to the addition. This small triangle is the additional utility by adding any additional investment in health. So the change in utility divided by change in health gives you the marginal utility in health. And if we wanted to show that by graph, so if you pay attention in this graph, this is the marginal utility curve for health. In the horizontal axis, we have health, and in the vertical axis, we have marginal utility, not the total utility this time. When we put the marginal utility in the vertical axis, you see that we have downward sloping, and this means that this has a very important, basically application in policy, because in economics we say that people make decision, rational people make decision at the margin, means that based on the marginal utility they decide to invest in any activity. And a policymaker, they can use this concept of marginal utility of investment for optimal allocation of goods and services.